Nikki, this is Dave. I'm just doing a quick sound check.
Hi, yeah, Dave, I can hear you just fine. Can you hear me? No?
I can hear you, Nikki.
Okay. I wasn't sure if Dave could hear me or not.
Nikki, if you can hear me, I think you're speaking, but I can't hear you.
Okay. Elke, you said you could hear me. Is that right?
That's correct.
I can hear you, Nikki. I can hear you, Nikki. This is Kelly.
Okay, thank you. I'm not sure what to tell Dave.
Well,
Let me see if I can chat him here.
it might be on his end.
All right, Nikki, let's try this again. Can you hear me?
I can hear you fine. Can you hear me?
I can hear you now that I turn my speakers on. I'll go back on mute.
Excellent. Okay, thank you. Okay, I think we have our panelists. The two most important ones are Director Jeppesen and Elke Shaw-Tulloch have both joined. So thank you for joining us for this media briefing about COVID-19 vaccine in Idaho. My name is Nikki Forbing-Orr and I'm the moderator today. We'll be hearing from Health and Welfare Director Dave Jeppesen and Public Health Administrator Elke Shaw-Tulloch before we open it up for vaccine-related questions from our media participants. We will not be taking questions from the public at this time. Please note that everyone should be muted unless they are speaking. And so with that, I will turn it over to Director Jeppesen.
Thank you, Nikki, and I'll just dive in with a short update, and then we'll hand it over to Elke. Just wanted to again reiterate that our commitment is to communicate timely and transparently, and to share data as we have it available. And we remain committed to that, and these press briefings are part of that commitment. We also remain committed to a vaccine rollout that is safe and as quick as possible. And to that end, last week, the governor approved, as you know, the CVAC recommendation to start vaccinating first responders, pre-K through 12 teachers and staff, daycare staff, and correctional and detention facility staff. And many of them have received their first dose just this last week, and many more are scheduled to get their first dose this week. And we're very, very happy about that. Looking forward, those 65 and older will be eligible to receive the vaccine starting in early February. And I will just note that we've published an updated timeline with a little more detail on our website with those categories, the groups that we have, and a little more information about those in terms of size, etc. So far, as of today, we've seen 69,398 doses administered to date. We continue to see our capacity across the state to increase, with an increase of 48% of doses administered last week over the previous week. Our capacity to administer vaccine continues to improve, and that's particularly important as we prepare for the large group of Idahoans 65 and older starting in early February. Plans are in the works by local public health districts, enrolled healthcare providers, and others to accommodate this increase in volume, and Elke will speak to that a little bit more later on. To help support the increase in vaccine administration capacity, I'm pleased to announce today the COVID-19 vaccine capacity, safety, and reporting grants for enrolled vaccine provider organizations. The purpose of these grants is to increase COVID-19 vaccine administration capacity across the state while maintaining safe storage and handling, to ensure equitable distribution of the COVID-19 vaccines, and to support timely and accurate reporting of vaccinations. Enrolled vaccine provider organizations can use the grants for items such as increasing resources and staffing, purchasing needed equipment and supplies, develop and implement strategies to ensure access for hard to reach and vulnerable populations, and many other items to meet the goals of this program. To be eligible, healthcare provider organizations need to be enrolled in need to be enrolled as COVID-19 vaccine providers. They need to timely report vaccines that they've administered via the state immunization system, which is called IRIS, and complete the necessary attestations. The grants will be paid monthly through priority groups 1 and 2. The amount each enrolled healthcare vaccine provider will receive will be based on the number of doses that they administer. And then communication will go out today directly to healthcare providers with the details of those grants and what they need to do in order to qualify and get those grants. So finally, I just wanted to emphasize that it still remains extremely important to wear a mask, maintain 6 feet of distance between non-household members, and to wash your hands frequently. And with that, I will hand it off to Elke Shaw-Tulloch, our Division Administrator for Public Health.
Right. Thank you, Director Jeppesen, and thank you, everyone. Today, I will be going through a little bit more detail on doses distributed. I want to review the actual process that we take to get vaccines allocated to the states, all the way through how they are distributed out to providers. And I also want to talk a little bit about some of the regional plans that are going on to get vaccines administered. So to start with, the director did mention the number of doses that we've administered to date, and so I want to give you a little progress update. I wanted to draw your attention to the coronavirus site. We do have, just as a few minutes ago, more updates when you go to our Tableau dashboard and you see the map of Idaho. You can see that we've have more doses populating that map. There was a period of time where that was not updated. So just to draw your attention to that, it does not change the overall number of doses administered that the director just mentioned. We still have administered 69,398 doses of vaccine. So I just wanted to make sure that you were aware of that. To jump to the doses distributed, I wanted to tag on to what we talked about last week. And last week we shared that Operation Warp Speed was going to be releasing all of the doses of vaccine to the states. We were uncertain about what that entailed. We were waiting for additional information ourselves. Then we also heard that we wouldn't be getting our second doses of vaccine. So there's been a lot of, over the course of this last week, a lot of different rumor, conjecture, things that we've been trying to chase down. And so we've been getting these conflicting messages, but what we have been able to confirm with multiple sources is that that those are not accurate reflections of what's actually happening, that we are going to continue to receive those consistent allocation of doses. We just issued a press release about this the other day. And not only will we be receiving our consistent allocation of doses, but we also have certainty that we'll be receiving the equivalent second doses. So we had talked in the past about for every dose that we receive into the state, there is a second, it's partner dose, if you will, that's being held for the second dose. So we are expecting that that will continue. And of course, however, as we learn more, as the Biden administration comes into place, we will make sure that you are aware and informed of what we know and when we know it. So by the end of this week, Idaho will have received 71,175 doses of Pfizer. So that's the same number that I talked to you about last week. But our Moderna doses have increased up to 92,800 doses of Moderna. That counts for both first and second doses for a total of 163,975 doses that we have into the state. That includes also those doses that have gone to long-term care facility pharmacy partnership. So that's your update on the doses distributed. And I thought what might be an important thing to be able to share with you is actually the actual process of how we get doses into the state. So I am going to share my screen with you, and I'm going to review with you, and I'm calling it a preliminary document because we might want to make some changes to it. I need sharing privileges, Nikki, I'm sorry. I want to be able to, we want to be able to get it posted, but we need to make sure that it is completely visible when we get it on our website. So there we go, and I can share my screen. Okay, hopefully this, oh geez. For some reason, my apologies, this happened to me last time as well. So I am going to, I will talk you through it. That might be the easiest thing to do. Again, we've received a lot of inquiries about how our doses are allocated, ordered, and distributed. So I'm going to walk you through the process. So essentially, every week is the same in terms of its process. And so every week on Tuesday, we learn from the federal government what is going to be our estimated doses that, or and what we're going to be, excuse me, let me repeat that. Every week on Tuesday, we learn from the federal government what we are estimated to be allocated. So they send us an estimation, and it's populated into a system called Tiberius that I'm sure that you've heard about before. It's then confirmed by the federal government the next day on Wednesday. Also on Wednesday, we share that those final allocation numbers with our local public health districts, which is based upon the population estimates for each priority group that's being vaccinated. For example, we learned from the federal government that our confirmed number of doses is a certain amount. We look at the population estimates for the priority group for which the health districts and their community partners are vaccinating. And then those doses that we have confirmed to come into the state are then redistributed in numbers out into the local communities based upon the numbers of people in those priority groups. So that currently everyone is vaccinating in priority group 2, and the director went through that priority group. So our doses that are being allocated locally are based upon those population numbers. So then Thursday through Sunday, the local public health districts work with all of their local providers and their partners to finalize the plans for those numbers of doses that each provider that's enrolled in IRIS will be shipped. And remember, those doses are shipped directly from the manufacturer to those enrolled providers based upon the conversations that the districts have had with those providers and the numbers that they solidify. So then on Sunday and Monday, the state immunization program places the orders with the federal government for both first and second dose orders. Then after those orders are placed, Tuesday through Thursday, those vaccines are shipped directly to those enrolled providers per the allocation plans that they created in partnership with local public health. So every week that process repeats itself starting on Tuesday. So therefore it takes approximately 1 week from knowing how many doses were allotted by the federal government to the time they are actually received by the enrolled provider. So hopefully when we get further into this, I'll be able to get my screen sharing resolved while we're asking questions, and I might be able to pull it up because I know it's hard to follow that. I also want to take a minute and talk about the regional distribution plans, because I want to highlight that each of the local public health districts, in partnership with their regional enrolled providers, have taken on a lot of really great novel solutions and traditional solutions as well to make sure that they're getting their vaccine out into the community. Just as a reminder, those regional providers are following the priority groups. So if you recall, group 1 was healthcare providers or healthcare personnel and long-term care facility staff and residents. As that priority group 1 was sort of waning in terms of the numbers we were getting across the state, making our way through that priority group, then we expanded it, as you all know, to frontline essential workers and people over the age of 65. So this will be carried out across the state. And as we're hearing, this week actually we've been on conference calls with a lot of the health districts and their regional providers, and they've been doing a variety of things. So we've been hearing about mass vaccination clinics where they're having that high throughput volume of people moving through them. They have set up mobile clinics where they're going to going to the place where they need to be administering those doses. Clinic providers are setting up scheduling appointments and filling all those slots so they can be moving through those at a cadence to make sure they're getting through a higher volume of people. We've been hearing about large conversations for large events as we get into population groups that have higher numbers. We have healthcare providers that are ramping up their ability to increase their volume, almost tripling it in some instances. And now when we have these provider capacity enhancement grants that are going to be available, they'll really be able to ramp up that potential. So there are a lot of other novel solutions. Some of them are using our Idaho National Guardsmen to help stand up some of these testing events, local health district staff that partners with National Guard and community providers to get those vaccines out. So again, there's a lot of variety in how the doses are being administered and trying to make sure that they meet the population's needs for getting those out. Of course, the biggest issue that we hear from providers is we need more supply because the demand is great. And we love the fact that we have such a high demand for the vaccine. And I'm very happy that we have people that are clamoring for it. The last thing I wanted to mention is last week I did talk about a registration function that we had hoped to stand up this week. It was a tool that we mentioned called PrepMod, and we anticipated its availability, but in looking at some of the functionality of it, we wanted to make sure that the functionality was appropriate and it was going to meet our needs. And so we feel that there are still some issues that we need to resolve. So we are delaying the stand-up of this tool, and we want to make sure that we have it as soon as possible, and we'll continue to keep you informed in these press briefings. Our hope is to have it by the end of this month or early part of February, so as we move to the age 65 and older for our priority populations, that we have it available. So again, we will continue to keep you apprised in these weekly briefings, and that's why they're so important and so effective, is because as things are ever changing, we have the opportunity to talk to you all and let you know what's happening. I'm going to do my due diligence and again echo what the director said about the importance of wearing your face coverings, staying 6 feet apart, and making sure that you're using your proper hand hygiene and keeping your surfaces around you clean. So with that, Nikki, I'll turn it back to you.
Okay, thank you, Director Jeppesen and Elke. We will now take vaccine-related questions from the media participants on the call. We're going to answer as many questions as possible in the time we have available. Please raise your hand in WebEx by selecting the hand icon to the right of your name in the participants list, and you can also type your question into the chat area, which you can access in the lower right part of your screen. When I say your name, please unmute yourself and announce your name and media outlet before asking your question. Okay. Okay, I see Audrey Dutton has her hand raised.
Hi, this is Audrey Dutton from the Idaho Statesman. My question is about vaccine data. What data is available or being gathered about demographics and priority groups? So race and ethnicity of folks choosing to be vaccinated, how many teachers so far, how many healthcare workers in a long-term care setting, that sort of thing.
Thank you, Audrey. I'm going to do my usual. We have our team of experts here. So we have Sarah Leeds on the phone, our immunization program manager, and Dr. Christine Hahn as well. To get to the first part of your question, I know that we do base the vaccine distribution based upon the priority populations, as I mentioned. So we have estimates of how many teachers, for example, there are in a certain area that they're vaccinating, I think down to the county level. So distribution is based upon population estimates. In terms of demographics that are actually collected on each individual, that I'm going to have Sarah and or Dr. Hahn confirm this, but I do not believe that our immunization registry collects that demographic. I believe it's just some very basic information, but I will turn that over to Sarah.
Yeah, thank you, Elke. That you are absolutely correct. Idaho's immunization information system, by state statute, only collects very minimal information about the individual and the doses that they receive. So race is not anything that is a mandatory or something that IRIS captures.
So is there any way of knowing then what the uptake is among certain groups?
And Sarah, I'll hand that back to you, but I can't. Oh, Dr. Hahn, I think you were.
Oh, I was just going to say, yeah, Audrey, obviously we would love to know that. In the first group is kind of easy because in the beginning, you had to either be a healthcare worker or a long-term care facility resident to get the vaccine. So I think we're going to have pretty good data on that until the group got opened up. We're also reaching out individually to hospitals and asking them to let us know among their staff, because those are a pretty big chunk of the healthcare workers that at least initially were getting vaccinated. We've asked them to give us some information. Of course, they're all still in the process of vaccinating, so nobody's giving us sort of a final number yet, but we should have from hospitals and larger facilities those numbers eventually, so we can, I mean, soon, not in months or years, but pretty soon we'll know how good the uptake was at hospitals and other larger healthcare employers. As we move out into more general, obviously age group is another one, will be pretty easy because that is captured. So we will have a good feeling for how we're doing in various age groups. Where we're really going to be challenged is when we move into those frontline essential workers. Because the providers are going to be sometimes vaccinating people in a group, like everybody, let's say a certain police department, everybody might get vaccines at the same time, but in the other communities, they might be showing up individually at clinics or urgent care centers or places that the public health districts have set up for them. So that data, as Sarah mentioned, our registry is very limited on what we can collect. And so we're really going to have to be creative in trying to get the estimates on those in those groups. But for the healthcare worker group, I'm hopeful that in the next, I hate to say a time frame exactly, but I think fairly shortly we should have some pretty good estimates. We are hearing a pretty good uptake anecdotally from the hospitals, and obviously they're still in the midst. They aren't finished vaccinating even their own employees because of the 2-dose regimen. So we will try to get those numbers as quickly as possible and get those out.
Okay, I have a question in the chat from Bailey Merrill at BYU Idaho Scroll. She would like to know, how have the vaccines affected the amount of COVID-19 cases in Idaho so far?
Thanks, Nikki, and thanks, Bailey. I'm going to turn that over to Dr. Hahn because I know I heard her answer this in a call earlier today. I'm going to give her the opportunity.
Yeah, that's a great question. We don't expect that it has had a large impact yet. What we're excited about, because it's, we don't nearly have enough vaccinations in folks to have, certainly we haven't achieved any sort of herd immunity. However, I think at a micro level, we're already seeing benefits. I did hear from the Idaho Hospital Association today and others on a call that even having healthcare workers vaccinated, there's the feeling of progress and the feeling that, actually, I'm sorry, I said it was from the IHA today, but was actually in a discussion with a medical provider yesterday where they have a large number of staff. And he said, I think we're seeing fewer folks out, out sick or out and not well. And we are hoping to shortly roll out some information to people who are fully vaccinated that they won't need to self-quarantine if they're exposed. So we're hoping to see the first impact is on healthcare capacity, hospitals, clinics, urgent care centers having better staffing. Disease rates, I think, are going to take a little longer.
Okay, thank you. We have a question here from Melissa Davlin.
Hi, I was hoping somebody could give me some more insight into the interface with the federal government after not just the confusion that happened last week with the number of doses Idaho was expecting to receive by the end of the week, but also with the incoming Biden administration. I know that the department asked for more clarity moving forward from the federal government. Have you received any explanation, any communications about what happened, or are we just assuming now that we're going to see that maybe 2 to 5% increase that you mentioned in last week's statement?
Yeah, thank you, Melissa. I know from my experience, we continue to have on some of my national organizations calls. We have members of the Biden administration coming and talking to us. They told us actually at the end of last week that we might not have the full picture of the details of their plans for a couple of weeks. I think I liked their quote that you can only have one government in at a time. But saying that, I know that Sarah Leeds also participates in her federal calls all the time with CDC and others and has heard more assurances about what they know. So I will let her address that.
Yeah, thanks, Elke. I have been in a minimum of at least 3 calls since the last press conference where we asked those questions, and the news headlines appear to be rumors, and I don't know where they were stoked, but they appear to be rumors because the federal government is assuring that there are second doses for every allocation that we get weekly. They have reserved, like Elke said, that second dose so that we don't need to, our providers don't need to ration those doses. If they get 1,000 doses this week, they need to split that and hold 500 of them. They don't need to do that. So I've heard from 2 sources at the federal level that we are assured that those second doses are coming. The second challenge that we have is that we right now are receiving just over 20,000 doses a week, and that is where really, as we open up, going to be our bottleneck, and we continue to ask for not only additional doses, knowing that we have a lot of providers ready and anxious to administer doses here in Idaho, but we also continue to ask for, even if it is to remain just about 20,000 doses, if they could let us know several weeks in advance so that our providers can have better planning ahead of time for those mass vaccination clinics, and that we can coordinate among providers to get more people vaccinated in a streamlined way rather than just a week-to-week situation.
Okay. I think our next question is going to come from Trevor Fay. Trevor, you'll have to unmute yourself.
Thank you. That was that's what I was just asking there. Hey there, folks. Just a quick question. This is Trevor with CBS 2 News. I'm wondering, in regards to the vaccine distribution, obviously, you know, a lot of people are clamoring for this, as was mentioned, which is good, but have there been any concerns about folks mistrusting the vaccines or not willing to get them on moral or religious grounds, and what that might do for the rest of the population?
Well, I'll start, and I'm sure that others have other things to add, but of course, there are always going to be, you know, individuals who do not want to take the vaccine for a variety of reasons. That could be just trepidation. I want to wait and see how it affects other people. It's against my principles. There's a lot of reasons why, but we have not seen any influx of that sentiment that's preventing large numbers of people from coming forward. So I will leave it at that. So far, so good for us, but I'll see if the director or Sarah or Dr. Hahn have heard anything else from some of the conversations they've had.
Well, go ahead, Director.
Go ahead, Dr. Hahn.
Oh, I was just going to say, yeah, as Elke said, we know we'll never achieve 100%, and we understand that people have all sorts of reasons for declining. Some may feel like their health right now, they're concerned about it for various reasons, or they may not be, they may be planning on eventually getting it, I guess, but they may choose to defer until later for various reasons. I have not heard particular, you asked about religious or moral reasons. I have not heard any particular ones there, but Sarah, being closer to the program level, might have heard some. To me, I think the main concerns we're hearing is, of course, the speed with which this vaccine has been developed, the fact that, I mean, there are, of course, some people that don't believe that there's a pandemic. There are people that feel that they'd rather wait and see how other people fare that have been vaccinated. So we're hearing a variety of things out there. But as I mentioned, we're pretty pleased with so far in the hospital settings. It seems like the uptake is pretty good. We don't have final numbers yet, but we are hearing that the hospitals are generally, most of their staff are interested in receiving the vaccine.
So at least for now, it seems like there won't be any problems with gaps in distribution or receiving based on, you know, people declining.
Yeah. Go ahead, Director. Go ahead.
I was going to say, I'll just answer that. Yeah, our problem right now is demand far exceeds supply. And so there are many hundreds of thousands of people that are anxious to get vaccinated. And there's been no disruption in that demand of people wanting to get to get vaccinated. Our struggle has been on the supply side, as we've addressed in several questions here so far. And even there was some surveying going on that sort of showed that it looked like there was less people interested in getting vaccinated, but once the vaccines arrived, we've actually seen that data turn around, and it looks like there's more people that are interested in getting vaccinated. So for now and for the foreseeable future, our biggest challenge is not enough people wanting to take the vaccine, it's getting enough doses in the state to meet that demand.
Excellent. Thank you.
Okay, it looks like our next question is going to come from Joe Paris.
Thank you, Nikki. Joe Paris with KTVB here. Two quick questions. My first one is on the Idaho Prep Mod website. I was forwarded a link that looks like the website is up, and I've been told by a few people that they've tried to enter their information into it. I just wanted to clarify, is this website maybe up and it shouldn't be up? And for people that have put information into it already, will that info be saved, or is it going to be cleared and relaunched?
I'm going to let Sarah address that question. We have not posted. It could be that maybe a provider who is using PrepMod for their own scheduling purposes has something up. We have a test platform for PrepMod, which I'm hoping is not up. But Sarah, do you have any additional information?
I can just confirm what you said, Elke. To my knowledge, that that public facing, just for a general public member of the general public, that was not posted. So I to absolutely confirm that, I need to go back online and check. But we it was never our intent if that's up. So
Yeah, I am
I'll
seeing some.
confirm while we're talking, but yeah, I think that's probably Elke's explanation is likely it's a provider having a site ready for a clinic for a person to register, and it's just not live yet.
Okay, because the person that had forwarded it to me said they went through the steps and had just heard that the site wasn't up, but they had gotten confirmation that they were part of Group 1C. And I was curious if that rang a bell.
That might, the test platform, that's one of the things that we wanted to be able to deal with the functionality is currently the way PrepMod is constructed as a tool that we've purchased has already preloaded the ASIP phases, if you will. So ASIP phase 1A, 1B, 1C, which are different than how we're calling our groupings. So if I'm seeing a chat that's sent to me that if you Google it, you can find it, but we will check on that. If it is somehow live, which it should not be, we'll make sure that it's down until it has its functionality.
Okay, so just to be clear for people listening at home, this is a mistake and the PrepMod tool is not officially launched, as you guys mentioned, hoping by the end of the month?
Correct.
Okay. And then my second question for you, kind of touching on what Melissa Davlin talked about, with those stories on Friday about the news that the federal vaccine stockpile may not have existed. I know that Oregon Governor Kate Brown had mentioned that their timetable and their waves to get vaccines out were going to be pushed. One specific example is they're saying that seniors would have to wait 2 more weeks to get their vaccines. Is that something that I guess could come into play here in Idaho, or is there confidence that the current waves will not be affected by the news that came out Friday?
Again, I'll turn this over to Sarah, but we had already been told our kind of an estimated allocation to the state of Idaho. And fortunately, we didn't quickly pivot and change all of our plans to account for something different in terms of our distribution. So we've been maintaining sort of that same expectation of allocations. But Sarah, I will let you wrap up that.
Yeah, I just confirming what Elke said. We have no guidance to change the way we're doing things. So we always have a kind of a backup plan ready because things have historically since we've started vaccine planning for COVID-19 had to continually pivot, and I think we've come full circle. We've pivoted so many times, but we have plans in place that if things were to change, we have ways we can adjust. But right now we have no guidance to indicate the need for that. So we continue to plan for 20,000 doses a week of those primary first doses, knowing that that second dose is on its way either 3 weeks or 4 weeks later, depending on if it's Pfizer or Moderna.
Awesome. Thank you so much.
You're welcome.
Okay, we have another question from Audrey Dutton.
Sorry about that. So we've had about 69,000 doses administered versus 164,000 received. And recognizing that the 164,000 includes second doses, right? But a lot of people have drawn conclusions from that and are comparing us with other states that we're vaccinating people much more slowly than other states based on the percentage of people vaccinated per population versus the share of doses actually administered. We know that there are data limitations like the 3-day delay from IRIS, but that exists in other states too. And when you're looking at the gap there of almost 100,000, even at 20,000 a week, which is the highest I think that we've been at, a 3-day delay would not account for that large of a gap. So what is the reason that it's gone quote unquote slowly? Why have we only given about 2.5 or about 30% of our doses?
Elke, you want me to take that one, or do you want to jump in?
Sure, go ahead. Yes.
Okay. Yeah, actually, I think it's 69,000 of 164 is right around 42%. If I did my math quickly, somebody have to correct me on that. And there's really a couple of factors going on there. One is that there definitely has been a ramp up learning curve for providers into how to administer this vaccine. It has requirements of handling. It's a little more operationally intensive because A, we need to do appointments, and B, you need to keep people 6 feet apart because of the pandemic, as well as monitor for 15 to 30 minutes afterwards. And so there definitely has been a ramp up time period for providers to be able to carry that out and do that out in a safe and effective way. We also see that that capacity is increasing quite rapidly now, and we actually expect that capacity to go well north of 20,000 doses a week. In fact, just in the last 48 hours here, we've seen 9,000 doses completed. And so that's I think, reflective of the providers now having their processes worked out. They've done a great job and are now working into solutions to do high volume. So, for example, up in North Idaho, they did a high volume clinic at the fairgrounds just recently. There are really plans like that across the state now that the providers have a handle on how to administer this vaccine to really rapidly advance that administration capacity. And we expect that to continue. The other thing that I would say is that when you get 20,000 doses in, you don't put 20,000 doses in arms all that day. And so many of the doses that are not administered have appointments against them. And so what we're seeing is that it just takes time. When you get 20,000 doses in on Monday, it takes some time to get those out through the rest of the week. And so many of those doses are not sitting waiting for appointments. The vast majority of them, whether first or second, have appointments that are scheduled. And so we anticipate those to happen pretty quickly. And the last thing I'll say is, as I talk to more and more providers, they're really feeling much more bullish that they can get on a schedule that says for any dose that we receive, we expect to get it into somebody's arm within 7 days. And that's just a function of logistics and planning and those sorts of things. And so we think we're headed, the trajectory is very good. This last week, we increased 48% over the previous week. The week before that, we increased, I think, close to 40%. It might have been 38%. So the ramp is actually quite steep at this point. So we actually feel good about where we are, and we see that capacity continuing to increase. And well, there will always be a lag. There's going to be a lag between doses received and doses administered. But we see ourselves making that lag in the numbers of doses in that category much, much smaller over the next couple of weeks.
I guess where I'm not following is, so appointment times are always going to be an issue, and provider training is always going to be an issue in any state. So is it more of an issue in Idaho? And that's why we're slower than other states based on these data sets that we're seeing?
Well, I think that what we're really focused on is what do we need to do here in Idaho to make sure that we have an administrative capacity that exceeds the supply that we anticipate, so that we can make sure we get doses out as quickly as possible. I can't really speak to what other states' numbers are or how they're reporting or what their processes are, but I can speak to, I feel really good about what the providers here have done and the path they're on to accelerate and continue to grow that capacity. One of the reasons we announced the grants that we did today for providers is to help them financially, so that there's no financial barrier as we continue to grow capacity. The governor announced an increase in National Guardsmen that'll be available for this, solely for vaccination, to increase that capacity. So I'm not really in a position where I can speak to what other states' numbers are. I will say we do have some data lagging that's going on with our long-term care partners, the pharmacy partners. We know that they're on schedule to deliver all those doses on the bus before the end of the month, excuse me. to get those doses done. And they're working very diligently, but we know that there's been some lag in getting that data through from them as well. And so, we feel pretty good about the work we've done. We think we're on pace to get all the doses we've received out into arms. Again, there'll always be some lag on that. And so I think that, again, we're all I can comment on is where Idaho is and what we're doing. And as we look around the state, we see lots and lots of activity that is dramatically increasing capacity now that the providers have their processes in place.
Okay, we have a hand up from Bailey Merrill.
Thank you. Yeah, I'm with BYU Idaho School, and I was just wondering, there were those, I want to say 2 cases where Idahoans had allergic reactions to the vaccine a few weeks ago, and was just wondering, have there been any other reactions like that or adverse reactions to the vaccine?
Yeah, this is Chris. Oh, go ahead. Sorry.
No, I was just going to turn it over to you.
I figured you were. Yeah, so I just jumped right in. Yes, we continue to receive a couple, I'd say a report or 2 every few days of people being evaluated for possible adverse reactions to the vaccine. For the most part, these continue to be, again, we aren't seeing an increase overall. We're continuing to see a low, steady rate of those. I think what we're seeing is in line with what's being seen nationally, that while these vaccines are great vaccines, they do have, they're more reactogenic. They tend to cause more allergic reactions than other vaccines. And I'm sure you're aware that the CDC has come out with some updated guidance about that for people that have a history of allergies. And in addition, they've said that if you have an allergic reaction, an immediate allergic reaction to your first dose, you shouldn't receive your second dose. So we continue to work with providers to make sure they're aware of that and have that information. In addition, people providing these vaccines need to make sure, actually they should have this for any vaccine program, but vaccinators are reminded they should always have a health provider available that could manage an allergic reaction, including having like an EpiPen or epinephrine on hand and be able to send somebody in for health evaluation if needed. So fortunately, we have not seen, I think in that very first press release, we had one of those 2 vaccinees was in the hospital briefly. To my knowledge, and we continue to watch this, we have not had anybody else hospitalized. We've just had folks showing up for clinical care or in the emergency room with a few folks have had rashes, a few folks have had trouble breathing, like people, I just heard today about someone who had a history of asthma, and it almost seemed as if the vaccine had brought on an asthma attack, but they were able to be treated. They didn't need epinephrine or anything. They just used an inhaler and so forth. So yes, allergic reactions are definitely continuing to be reported. I just today met with Dr. Whitty, who is, you may know her name. She's been our physician that's really been working very hard on our long-term care issues. She's also been our lead for our working with our hospitals for crisis standards of care. Since thankfully our hospitals seem to be doing a little better, I'm transferring her. She's agreed graciously to take on being the lead and really watching for these adverse events, because it's been something I've been trying to do along with other things. And part of that will be that we'll try to put out information on a regular basis. So sorry, long-winded way of saying that, yes, because it's a new vaccine, we're being hyper vigilant, and we will continue to, as new vaccines get introduced, to hopefully get authorized by the FDA. We'll continue to do this, keep a very close eye.
No, that's great. Thank you. And then just a quick follow-up question, if that's okay. You said that these vaccines can cause more reactions than others might. And I'm just wondering if we have any information on why that might be.
No, not yet, Bailey. That's a really intense area of research right now and evaluation, because this is a whole new class of vaccines. Every vaccine has different ingredients in it, and they're looking at the vaccines to see if they can isolate what might be causing it. Because ideally, if you could remove that one thing, it might just be one of the preservatives or something like that, then maybe they could reduce that allergic reaction risk. So that is frantically being studied, furiously being studied, and hopefully they'll find this out.
Thank you so much.
Sure.
Okay, I see a hand up from Kyle Fonensteel. Kyle, you'll have to unmute yourself. Here, I'm going to unmute you. Oops. Oh, there we go.
Oh, hi. Sorry, I wasn't seeing an option to unmute. I apologize. My name's Kyle Fonensteel from the Post Register in Idaho Falls. I wanted to follow up on something that was mentioned at Eastern Idaho Public Health's board meeting last Thursday. They talked about the delays in the CDC's long-term care facility vaccination program. They said it was disproportionate in that program. The health district was able to vaccinate a lot of the facilities that they had been working with for vaccinations, but the pharmacy program wasn't able to. How widespread is this problem throughout the state, and is it different in region by region, especially in rural regions?
Yeah, thanks, Kyle. I'll start out, see if anybody else has additional information to add, but I do know that the long-term care federal pharmacy program, I think nationwide, has had some of these same experiences, and a lot of states pushing on them to say we need to get this moving faster. We have been assured in conversations that they are on target to get their dose administration done by the end of January, which is what they had in their agreement with the federal government. We had some changes with one of the pharmacies that was participating in the program for Northern Idaho. They moved it from one pharmacy in the program to another, but we haven't heard anything that changes the trajectory to get that program on target to the deadlines that they committed to with CDC.
Okay, I'm going to go back to the chat. I have a question in the chat from Karen Bosick. And Karen, I'm sorry, I just went blank on, I think you're on Eye on Sun Valley is your media outlet. Anyway, her question is, I've been told that Idaho would get more vaccine doses if it administered more doses. Is that true, or are we still getting an allocation based on our population?
I have not heard anything that supports that we would get more vaccine doses if we administered more doses from the incoming administration. But I'm going to turn that to Sarah to see if she's heard anything that is different.
No, I've not heard anything from incoming administration. And in fact, we were funds and doses right now as they award supplemental funds to help us at the state and local level make this vaccination process successful. It is generally done on a pro rata basis. So that's the way they've been doing it, and we have not heard anything different as we move forward.
Okay, thank you. I have another question here from Audrey Dutton.
Yeah, I was wondering if you could let us know where we can find specific vaccination plan, or if we have a supply to meet demand. Is that on the website, or where would we find that?
Audrey, unfortunately, the first part of your question cut out. I know you said, where would you find, and then it dropped for a minute.
Sorry about that. Where would we find the specific vaccination plan for if we get enough doses to meet demand? What is the plan for getting those out into arms? Where would we find that? Is it on the website?
Each local public health district is working with their local providers to ramp that up, scale up as necessary. So I know that they have their individual, I don't know if they have a written plan per se, but they do have their individual agreements and operational discussions with their regional providers. So there is not unless I be corrected, we don't have a plan that shows that on our website, what that looks like, because we haven't really had the opportunity with knowing for certainty, what the doses would look like. So we're learning as we go a little bit too. I know that we have some assurances that we'll be having a consistent approach. And hopefully the promise as we get other vaccines that come online, we'll have even, of course, increased capacity with the other 2 vaccines that seem promising right now.
So the on the ground rollout, sort of logistics and all that stuff, those are the health districts are running the show there.
Correct.
Okay, thank you.
Mm-hmm.
Okay, we have another question from Kyle Fonensteel.
I wanted to go back to some of the discussion about the federal vaccine reserve being depleted. Where have you heard, who has told you that the vaccine reserve is still there and you'll still be getting second doses in 3 to 4 weeks?
Sarah, I'll let you take that.
So I have asked our project officer at CDC and our Operation Warp Speed liaison. We meet with them weekly. And then I've also asked, there's an association of immunization managers that represents all the immunization program managers around the country. And they work closely with CDC, and I asked their executive director to please check in with any connections she has, and she did that today, and confirmed that any information about there not being second doses is a rumor. So 2 separate sources.
Okay, Kyle, you still have your hand up and I don't see other hands. So if you have another question, you can ask it now.
Oh, sorry. No, thank you. Appreciate your time.
Okay, I don't see any other hands, and I believe we've answered all the questions in the chat. So we will wrap it up for today. We are planning another media briefing about COVID-19 vaccine at 2:30 p.m. Mountain Time on Tuesday, January 26th. We will announce those details on Monday. Thank you for joining us today.